Namaste once again. My dear students, I hope you're doing well. We have known each other from some time now, and we have finished the Level 1 program together. Level 1 program, as you all know, helps to build up a strong foundation. Once the foundation is strong, we can make a good quality building on that. Level 2 program is basically that building. Through Level 1 program, you have understood the basic history and philosophy of Ayurveda. We understood the nature of this universe. We also understood the nature of this human being, human body, human mind through the concepts of doshas, dhatus, agni, mala, strotas, etc. We understood if all these are functioning properly, then we get good health. And that good health is our basic nature or prakriti. We learned how to find out the prakriti of an individual. We understood that prakriti can define the health of an individual, and it's very important to know that. Because once we understand the prakriti of an individual, we can design his lifestyle, diet, and we can help him to live in a way so that that person does not go into vikriti or imbalances. After the understanding of prakriti, we moved to imbalances or vikriti. If you are living according to your prakriti, then generally strong imbalances or vikritis will not happen. But as there are many factors, sometimes vikritis can happen. So it's important to understand what these vikritis are. We understood that there are two different kinds: natural vikritis, unnatural vikritis. Natural vikritis cannot be prevented, but we can manage them and manage them properly so that we don't go into unnatural vikritis. That management of natural vikritis is called as preventative medicine. We have already understood the basic concepts of preventative medicine like Dincharya, Ritucharya, Achar Rasayan, Ahar Rasayan. And I'm hopeful that you have been practicing them from some time now and they have benefited you. Unnatural vikritis basically cause disease. So we also studied different forms of disease, different pathways of disease, and how to diagnose and understand a disease. We did disease examinations, Rog Pariksha, Rogi Pariksha, and once the diagnosis was clear, we also learned that basically disease are only of three types: degenerative disorders or vata disorders, inflammatory disorders or pitta disorders, kapha disorders or accumulative disorders. And all these diseases are basically treated by only two methods, that is Bringhan and Langhan. To perform these Bringhan and Langhan treatments, you have to learn certain skills, and we did learn some. Like we can perform Bringhan and Langhan through nutrition. So we enhanced our nutrition skills. We learned about various herbs because herbs are also Bringhan or Langhan. We understood different kinds of lifestyle modifications and also herbs because we can perform Langhan and Bringhan treatments through lifestyle modifications and even through herbs. At the end of the course, we also studied some common disease like obesity, diabetes, some common respiratory disorders, stress, anxiety, and some female disorders. After that, we basically asked you that you should study them properly, study this level 1 properly, and send us your notes. I hope this was a very good practice for all of you, because by writing those notes in your own language, you understand Ayurveda in your own language. Ayurveda is the science of common sense. I always feel that when we understand Ayurveda more and more, our common sense enhances, our common sense increases. We don't make blunder mistakes. But sometimes you must have felt that even after studying the level 1 course, whenever somebody comes to us with a complex disorder or a complex pathology, then it becomes a bit difficult for us. There are two different ways of studying disease. One is the Western medicine way, and other is the Ayurvedic way. You can see the difference. In Western medicine, body is considered as combination of various systems. So, for example, there is respiratory system, cardiac system, digestive system. So, in every system, some disease can happen. So, for example, if there is inflammation of the respiratory system or the lungs, then we can say that this is bronchitis. Within the respiratory system, too, there are many organs. So, if the inflammation is happening in your throat, then we can call it pharyngitis or laryngitis. If the inflammation is happening in the nose, then we can call it rhinitis. On the other hand, Ayurveda does not see human body as combination of organs or combination of various systems. Ayurveda see this whole human system as one unit. This one unit basically is so interconnected that once you understand the inflammation, whether that inflammation is in the lungs, whether that inflammation is in the digestive organs, or that inflammation in the bone is there, you have to do certain things which are anti-pitta or anti-inflammatory in nature. There might be different medications according to the tissue affinity, but some basic diet will be common for all the three systems. That basic lifestyle modification is very important, because if there is inflammation at one part of the body, that inflammation can travel. That inflammation can be there in other parts of the body too. That does not happen that only one part of the body have dryness or inflammation and all the other aspects of body are very, very healthy. Generally, whenever one system or one aspect or one organ of the body is stressed out or is facing any kind of disease, other parts of the body, they also have to compensate. It is one whole system which is in a constant communication with each other. That does not happen that all these systems, they are working in isolation. They don't work in isolation. They are in constant communication with each other. They are interdependent on each other. That's why when Ayurveda understands disease in a holistic framework. So, this holistic framework we will try to understand in this level 2 program. You must have already seen the curriculum. We will talk about 15-16 disease possibilities, but those 15-16 disease possibilities that we will study will help you to understand maybe 4,000-5,000 various disorders. Because in one disorder, different disease possibilities of Ayurveda can be there. For example, when we are treating an autoimmune disorder, Jwar or the fever is already present there. So we have to apply that Jwar Chikitsa or the treatment of the fever. At the same time, Ama is also present. So we have to understand Ama and we have to do Amapachana. At the same time, degeneration is happening. So we have to understand Vataroga and apply the treatment for degenerative disorders. According to various stages, we have to apply multiple disease possibilities and their treatments to understand or treat even one disorder. So this is the speciality or USP of this level 2 program, where we will not only study mere disease, we will understand the whole disease possibilities, and you will learn how we can understand complex pathologies in an easy manner, how we can apply these disease possibilities in one disease or the other disease. Level 2 program is very important for all of us because there are so many people around us, those who are suffering from chronic disorders, and they don't have enough awareness about Ayurveda. They don't know the potential of Ayurveda, which is already underused. I always say that, like, potential of Ayurveda is not used by the human society yet in its proper manner. So many people are suffering from metabolic disorders, high blood pressure, diabetes, autoimmune disorders, chronic ama disorders, but even in the psychological disorders. But in a conventional manner or in the modern medicine, they are provided only with few options. And sometimes those options contain a lot of side effects. Sometimes they have to take a pill or a medicine for their whole life. It is painful for those patients. They want to treat themselves naturally. They want to treat themselves holistically, at least wherever it's possible. There is a place for, of course, Western medicine. I always feel whenever there is an emergency situation, whenever the disease has crossed to a certain level that it cannot be managed by natural remedies, then of course Western medicine is very, very useful. In acute disorders, Western medicine is very useful. But in many chronic disorders, in many psychological disorders, we have to treat this body with compassion and holistically. Ayurveda provides that holistic understanding and compassionate way of treatment, that if these patients will understand it and apply it in their lives, their quality of life will be much, much better. So I always feel that we should always give these alternative methods or Ayurvedic methods to these individuals, those who are suffering from these chronic disorders, and they're looking for ways, they're looking for holistic ways to treat themselves. So I wish this journey of level 2 will be very fruitful for all of us, not only for you, but even your loved ones, or if you have any kind of health practice, then your patients, your clients. You can use this knowledge properly for the well-being of the human society. So get ready and brace yourself for this exciting journey.